Good morning, good afternoon, and good evening to everyone joining us today. It's a pleasure to welcome you to this webinar. Thank you for taking the time to be part of this session, which is part of the Safe Futures Hub seven-part series on interventions to end childhood sexual violence. I would like to warmly thank our speakers, whom you can see on the camera now. They bring deep experience, practical insights to today's discussion. And to you all participants, thank you for your commitment to advancing the safety and well-being of children. Please feel free to introduce yourself in the chats and share where you are joining us from. So today we are gathered to reflect on an issue of enormous scale and urgency. More than 1 billion children, nearly half of all children in the world, are exposed to violence every year. And within this, sexual violence in childhood remains a deep, pervasive, and harmful reality. 1 in 5 girls and 1 in 7 boys experience sexual violence during childhood. These numbers represent not only statistics, but millions of children whose safety, future, dignity, and development are at risk. At the same time, we know that violence against children is preventable, and schools can play a critical role in these efforts. For many children around the world, school is where they spend most of the time outside the home. This makes school a powerful entry point to prevent and address violence against children. Today's session will focus on how education can support children to learn and grow up free from sexual violence. And this session will share the latest evidence, highlight promising practice-based approaches, and explore where challenges remain and what needs to change to ensure schools are safe for all children. The speaker's presentation will be followed by a Q&A session. This webinar is being recorded and will be shared afterwards. Please submit any questions you may have using the Q&A session function. And while translation is not available on this occasion, you are welcome to use the transcripts function in the settings if that's helpful. With that, I'll hand over to Patricia Cardona from the Brave Movement for opening remarks. Over to you, Patricia.
Thank you, Manuela, for this introduction. I am honored to open this session. I'm a survivor of child sexual violence. I'm also an expert in child sexual abuse prevention and a member of Brave Movement. As Manuela said, this is an epidemic, but it's something that we study about, but there are not so many actions taken so that we can end child sexual violence. Brave Movement is a survivor-led organization, and our main 3 pillars are prevention, healing, and justice. We take action. We are in the G7. We go to the European Parliament, European Commission, whatever it takes to change the laws that impact children and also survivors. And we are very much determined to end child sexual violence. We are a young organization, but we have achieved a lot so far. So I will invite you to check our website, bravemovement.org. We can go to the next slide. And as I say, we are brave so that your children can be safe. And this is our motto, and this is what we live by. I'm gonna share with you 4 things that work, and I'm saving the most important, perhaps, for the last slide. I'm working with parents and mostly moms. They are the ones that are more engaged with their children's education. And I always tell them that they need to collaborate with schools. There cannot be gray areas between what is happening in school and what is happening at home and what kind of education we are giving to our children. From the school's perspective, it needs to be structured and needs to be clear who's doing what and when and who's taking the next steps after I have finished with my duty. That's where the protocols come useful, but everybody in every school and also the parents have to know what the protocols are in their own school so that educators can detect, can notify, and they can take care of the well-being of the children. The communication between schools and families has to be really fluent. So we can go to the next slide, please. Can we move to the next slide? Thank you very much. We need an no, sorry, the second, I think there's a delay. Thank you. We need to have an early detection, of course, and a child-centered response. We cannot expect children to collaborate with us. Well, what we need to do is to create the environments, create the language, create the settings so that children can talk to us, can trust adults, and they don't trust other children first or the internet or AI. So we need to be a reference. We need to become a role model. We need to raise our standards on who we are as adults, as parents, as teachers, so that children come to us and they have this open channel of communication. Then we can detect the behavioral and emotional indicators that can indicate that there has been sexual abuse or any other kind of abuse. If we are not educated and if we don't have the channel, it's very easy to not see them. Many children hide it very well, and if you don't have this open communication channel, it's going to be very difficult that they talk to you or that they even display these behavioral changes near you. So we must really listen to children and build a child-centered response and not an adult-centered environments, but really focus on children. We could go to the next slide, please. Thank you. This is where we can become really, really, really strong if we families and schools work together. We really need to have the same common language. We really need to align, and this will differ from country to country and even from region to region in the same country. We really need to adapt to the culture and to the social norms of the area. Only then it will work. We cannot do it from a policy standpoint and push it down without taking into account their social norms, their education, their taboos, everything. We need to take everything into account and see where we can start first. So even small steps will really, really help to achieve what we want. And this cannot be a 1 or 2 years initiative. This needs to be at least a 10, 20, 30 years initiative. So there's an increase of knowledge, increase of competence in all the adults. The adults are the responsible to protect children. We can go to the next slide, please. And this is the one I find the most important, is that we need to have safe emotional education. That's the foundation of everything. If we are having children who doesn't have self-esteem or self-awareness or confidence, they don't even have knowledge about their own bodies. They have to be able to name their body parts without any shame or guilt. And we can say vulva, penis, testicles, breast, anus, all these names without feeling any kind of shame. And this needs to be adapted to every culture, but the official name should be used so that when they report, they can use the right name, but also to tell them that there's no shame in these body parts. We don't have to give them labels, as we don't give a label to the hand, so the same way we don't give a label to the vulva. And we need to teach them to set boundaries. But we are the role model again. How are we setting boundaries in our own environment, in our own work environment, in the school, with friends, with families? We need to educate children's parents and caregivers. Otherwise, the children will be left alone. We are the ones who have to guard their well-being. Thank you.
Thank you.
Thank you. And you can contact Brave Movement there, and you can contact me at protegeconpatricia.com or send me an email if you have any other questions. This was brief, but I hope it was useful for you all.
Thank you very much, Patricia, for such a powerful, opening. And we are very grateful and congratulations to the Brave Movement for all the work that you do. Thank you for sharing, your work and, highlighting these best practices on schools being, frontline environment for child protection and the importance of having a strong bridge between families and school who must work together for the safety of children. Thank you so much, Patricia.
Thank you, Manuela.
So we'll now move to our next part, which is on the evidence spotlight. We will hear from Constanza Ginestra from Together for Girls and part of the Safe Futures Hub team to share an overview of the evidence on what works to prevent childhood sexual violence. Over to you, Constanza.
Thank you so much, Manuela. I'm very glad to be here. And I would like to mention first that my presentation will consist on two different parts. The first one will have a look at some secondary analysis that we have conducted with Together for Girls. And the second one will present the work, part of the work that we do at the Safe Futures Hub. Next slide, please. Next slide, please. So as you may know, probably the violence against children and youth surveys are nationally representative household surveys of adolescents and young people from 13 to 24 years old that generalize data on many aspects of violence in childhood and young adulthood. In the box, you can find data from the prevalence of emotional, physical, and sexual violence, the circumstances surrounding violence, also risk, protective factors, and the consequences of violence. So to estimate the prevalence of school violence, we conducted a secondary analysis of the box data in 40 countries that you can see in the slide. We looked at the prevalence of physical and sexual violence, school absenteeism, disclosure of violence, and also any service seeking and service receiving. Currently, this data can be found in country fact sheets and in the BACS data dashboard that we will share the links in the chat for you to have a look. But I would like, can we go to the next slide, please? I would like to show at least some of the findings that we have with this data. This graph displays the overall rates of SRGBV, school-related gender-based violence among survey respondents who experience one or more forms of physical or sexual violence perpetrated by teachers or classmates. You can see that there is a considerable variation in prevalence by gender. You see Uganda had the highest percentage of students experiencing school violence, with 54% for males and 45% for females. But also Nigeria was the only country where female students experienced the higher rates of SRGBV overall. Next slide, please. So this, you can find much more data. I have to be brief, but please go to the country fact sheets and also the BACS data dashboard for more data on this secondary analysis. But the key takeaway that I wanted to share here is that as you can see very briefly with that graph, violence in schools is gendered. There is important variations across national context. We also need more and better data for policymakers, for practitioners, for survivor advocates. They need quantitative but also qualitative data that really capture the array of SRGBV experience, but also the drivers, including social norms and attitudes toward violence. And finally, something that I think Patricia mentioned, something similar, SRGBV and school violence in general requires a multi-pronged approach. This means from the implementation on strong legal frameworks to evidence-based interventions and solutions that actually create a safe space for children to learn. And this and the solutions leads me to the second part of the presentation, where I will show you part of the work that we do as Safe Futures Hub. Next slide, please. Next one. So they have it's a joint initiative between SBRI, Together for Girls, and We Protect Global Alliance. Our primary focus is to promote the dissemination and scaling up of solutions to end sexual violence. And our work is informed by data, evidence, and different forms of practitioner knowledge. Next slide, please. So our pillars of work are mainly redefining, mobilizing, and generating knowledge. And as part of the mobilizing knowledge pillar, we have conducted last year a comprehensive systematic review that highlights what works to prevent sexual violence in low and middle income countries. So the approach to this review consisted first on sourcing the literature and defining the criteria for the inclusion of the studies. So we decided to include for this round only English publications between 2018 and 2024. And the focus was, as I said, on low and middle income countries or humanitarian settings. After that, we categorized the evidence by the Inspire strategies. I hope we can share it in the chat, the website to the Inspire framework for you to have a look to. And programs so in this graph, that we have is you can for the educational lifestyle strategy. Next slide, please. So when looking particularly at life skills interventions, we have found that broad-based prevention models in school curricula are effective to improve knowledge, skills, and help seeking. And occasionally, in some cases, these programs were effective of reducing teen violence. We also found that school-based defense programs were effective. There was a reduction in sexual violence victimization.
Constanza, may I interrupt you briefly because I think you are breaking a little bit. So perhaps you can turn off your camera and see if this helps with the connection. Thank you.
Thank you, Manuela. Let's see if this works better. Let me know. I will continue and you let me know if I have any issues still.
It seems better now. Thank you.
Thank you so much. Sorry about that. All right, so I was saying the other part of programs that seems to be effective to prevent sexual violence in schools are those that include some self-defense elements. We have seen some reductions in sexual violence victimizations in both humanitarian and stable settings. Also, curriculum design and educator training for deliver sexual violence prevention models have shown to be effective. They increase sensitivity regarding sexual abuse prevention, also positive attitudes and knowledge on sexual health. And finally, I wanted to include also this point, school-based interventions, programs for children and adolescents with disabilities. We have found some hopeful results, but these programs still need more and stronger evidence. You can see here that can we go back to the previous slide, please? I have included here some examples of programs for each of type of intervention. We have developed case studies for most of these interventions, so you can go to the Safe Futures Hub website and have a look at each of these programs and have more detail on why they worked to prevent and address sexual violence. Next one, please. Next slide, please. Thank you so much, Eronima. So can we go back to challenges? I will share gaps and challenges, particularly to this set of interventions on the education, but we can see that most of them are also applicable to the rest of the Inspire strategies. We have seen limited rigorous evaluations, especially in humanitarian settings. There's lack of data on long-term impacts and effectiveness of interventions. The literature on education often focuses on knowledge transfer rather than on actual reductions in childhood sexual experiences. And finally, further research is needed to identify best practices for adapting interventions across settings. We have more to learn about what core elements of a program have to stay the same and what must be adapted to context and how. And for finishing the presentation, next steps, we are currently working on the first living systematic review on solutions to end childhood sexual violence. This time we are including intervention in Spanish, French, and English. So please stay tuned with the work of the Safe Futures Hub. Thank you so much, and apologies for the internet issues.
Thank you very much, Constanza. And yeah, the connection was very good from the time you turned off your camera. So that was fantastic. And thank you very much for sharing your work around the importance of national data to understand the prevalence and drivers of school-related sexual violence against children, and for sharing as well effective interventions on education and life skills to prevent and address childhood sexual violence. Thank you very much for sharing this, Constanza. And I apologize because I was so excited to introduce our round of speakers that I realized now that I forgot to introduce myself. So my name is Dr. Manuela Ballier Ahogo. I'm the Deputy Director for Data and Research, and also at Together for Girls, and also part of the Safe Futures Hub team. With that, I'm very thrilled to introduce our incredible speakers for today, and they will share presentations on the work on how educational structures can support prevention of sexual violence against children. Starting with our first speaker, Dr. Deepak Naker, who is Executive Director and co-founder of the Coalition for Good Schools. We'll start with Deepak, then we'll have Abir Noor, a research fellow at the Population Council. Abir's presentation will be followed by Atta Mohammad, program manager at Right to Play. So Deepak, I'll hand over to you. Thank you very much.
Thank you, Manuela. Hold on, let me just turn on. Thank you, Manuela, and both to Patricia and Constanza for setting the ground so well. My name is Deepak, and I work for Coalition for Good Schools, and we focus primarily on preventing violence against children in and through schools. We were founded by 12 practitioners who were based in Global South and who were involved in developing interventions in schools and focusing on how we could respond to the issue of violence against children in schools. I know that a lot of information has come your way in a very short space of time, so I promise you that I really just want to use one slide to communicate 3 basic ideas to you. And then those are the bullets that you see in front of you. That my first point is that sexual violence, particularly in schools, but everywhere, is underreported and therefore not well quantified. So even the data that Constanza presented and others, in some ways, underestimate the level of violence that children experience, particularly sexual violence. That is because in some ways there's still stigma and taboo around reporting violence, and it also requires trust, which researchers don't have the time to build with respondents. So often you don't get full information and full access to children's lives about violence that they experience. And this is even more pronounced around the issue of sexual violence. So my first point is that the data that you see are likely to be an underestimate at the level of the problem. And this is particularly exacerbated by the fact that sexual violence is not some random thing perpetrated by a few rogue people, but it's a systemic problem. And let me explain what I mean by systemic problem. It's just a fancy word to say that essentially all of us are surrounded by systems that influence our lives profoundly. So, you encounter health systems, hopefully not the judiciary or justice systems, but all sorts of systems. And they are basically just beliefs, attitudes, policies, procedures, actions, behaviors, things that are clustered together and aligned around delivering a particular outcome and an experience. And in children's case, the most salient system is the education delivery system. And what my contention here is that the education delivery system, in some ways, uh, underrepresents the problem, discounts the scale of the problem, doesn't pay sufficient attention to the problem, perhaps even gives tacit consent to certain beliefs and attitudes that perpetuates the problem, and in some ways essentially allows it to happen in school system. And then it's a system that hasn't addressed or reckoned with the fact that children experience sexual violence and physical violence and emotional violence and psychological violence in schools while they are going through the school system over a prolonged period of time. So a systemic problem really needs a systemic solution. And by systemic solution, what I mean is that we shouldn't think of interventions just in one place of that entire system. And certainly not only one particular duty holder or an entry point from which we should act. That systemic problem deserves systemic response in the sense that we should address the entire ecosystem of the school delivery, education delivery system. So starting from people who are responsible for making policies about how schools and education will be run in the country, to folks who are developing content and curriculum in schools, to people who are the foot soldiers of delivering the content in terms of teachers' education and teachers' training, to oversight folks whose role is to see how education is delivered, to the point of sale, where in some ways how children encounter the education system, which is schools. And that is why we need whole school approaches rather than just isolated interventions that only address one constituent part of the problem. So it is really important that we build life skills in children. It is really important that we build emotional management skills and social emotional learning skills within kids. But it is also crucially important that we surround them with an operational culture that makes all the skills applicable, usable, endorsed, and salient in children's lives. So in some ways, what we are saying is that we shouldn't squarely put the responsibility of preventing violence, particularly sexual violence, on children acquiring skills to protect themselves, although that is crucial and important, and we should do that crucial work. We should also invest in terms of the environment within which children are surrounded and the value system and belief system that surrounds them when they encounter school. You might think that that is in some ways a daunting task because schools are spread out all over the place and there are thousands of schools in each country. And how are we going to do that? Let me give you just one example of a place where this is happening. In Uganda, for example, we've developed an evidence-based response and intervention that takes on board these ideas that violence is a systemic problem and that we need to respond at a systems level. And it works with all stakeholders in schools. It works with parents, it works with teachers, it works with students, and it creates opportunities for them to play a leadership role in creating a new kind of school. And you can learn about this evidence-based intervention called Good Schools Toolkit on Raising Voices, the website, where you will see the description of it and the evidence base behind it. What you will also learn is that it's not just enough to create an intervention in schools. You have to work upstream from school as well. So, for example, a whole load of stakeholders in civil society have been working in places like Uganda, East Africa, and other places, working with governments. And in 2024, we had the Bogota conference where people came and made pledges. And the government of Uganda, for example, made a specific pledge to take this kind of intervention to scale so that by 2030, they're going to take a systemic intervention, prevent violence against children in and through schools, every school in Uganda. And that's the kind of intervention and joined up thinking that we need to do if we are going to address violence against children in schools, particularly something as egregious as sexual violence against children in schools, because sexual violence in some ways is not only underreported, but also not well understood. So often the data that you see is about coerced sex. And coerced sex is a very egregious form of sexual violence, but there are other forms of sexual violence as well, from harassment, from shaming people's identity, from naming people's body parts and creating that as a point of shame, to peers then taking on those values and in some ways sexualizing each other rather than treating each other as individuals. So even the issue itself is much bigger than just coerced sex. And that's something we need to take on board. It's a complicated thing. It requires a deep-seated conversation. It's a long-term intervention. There's no short magic bullet solutions, but it requires accompaniment with the entire system such that we immerse at a place where a whole operational culture of school changes. So that in some ways, the nature of relationships that we are creating between encouraging teachers to create with students and students with each other is based on justice, based on respect, based on dignity, around bodily integrity, and just honoring each other as fully independent human beings. And if we do that, then not only do we prevent sexual violence, but we prevent all forms of violence against children. So systemic solution is really a sustainable way of moving forward. Thank you. I'll stop there and back to Manuel.
Congratulations, Deepak, for the incredible work that you do with the Coalition for Good Schools and for sharing this expert insight on sexual violence, as you said, that often go unreported and occur within a system, highlighting the need for a systemic response through a comprehensive whole school approach. And thank you as well for sharing the example of Uganda. We now move to our next speaker, Abir Noor from the Population Council, to share her presentation on educational sector structures. Over to you, Abir.
Thank you so much, Manuela, and hi everyone. So I'll be sharing an intervention that was designed for schools in refugee settings in Uganda to prevent and respond to sexual violence against children. And I'm talking on behalf of the Baobab Research Program Consortium that is led by the Population Council in collaboration with the African Population Health Research Center, as well as the Population Council Kenya. So before talking about the specific intervention, I want to give you a bit of background. So where did this intervention come from? So on the next slide, as you'll see, and I think as some of you already know, in 2022, the Baobab RPC, in collaboration with the government of Uganda and UNHCR, conducted the first ever violence against children and youth survey exclusively in humanitarian settings. And so in Uganda, we conducted this survey in all refugee settlements. And the findings from the survey highlighted the high prevalence of violence against children, including of sexual violence in these contexts. Another key finding is that highlighted the importance of the education sector and specifically of schools as a powerful and a really efficient platform for reaching children, given that over 90% of children in these refugee settings in Uganda were enrolled in schools. And also given that classmates were often reported as being the perpetrators and schools as being the premises where violence occurs. So a few months later in 2023, through a subsequent data to action workshop, humanitarian stakeholders in Uganda came together to identify priorities for action to respond to violence against children in these refugee settings. And these priorities led to the design of the school-based intervention that I'll be talking about. And the main goal was to address two key findings from the HVACs. The first one being the very low disclosure rates by child survivors of sexual violence. And the second one being the very low uptake of available sexual violence services. So this school-based screening for sexual violence intervention was implemented in Chirindongo refugee settlement. Next slide, please. That is located in northwestern Uganda. It was implemented in 2 primary schools out of a total of 5 schools in the settlement. And in this specific settlement, the majority of refugees are from South Sudan, although there have been a more recent influx of refugees from Sudan and the DRC. I'll give you an overview of the intervention itself by describing it before giving you an overview of the findings or what this intervention has showed us. Next slide, please. So first of all, this intervention was implemented by parasocial workers. So some of you might know these parasocial workers in Uganda are the first line responders when it comes to child protection cases in refugee settings, and they work directly under the Ministry of Gender in Uganda. So this program was implemented by those parasocial workers in 2 primary schools in Chirindongo refugee settlement, and it comprised 5 components. Next slide, please. So the first component are the parent dialogues. So we targeted children in primary 6 and primary 7 in these 2 schools, and we worked with these schools to invite all parents of children who are enrolled in these classes to hold a discussion about sexual violence in their communities, about sexual violence in their children's lives, and also to think through possible solutions. These dialogues were also used as platforms to obtain parental consent for children to participate in the program. And later on, when towards the end of the program, they were used to feed program results back to parents. And overall, we held 3 parent dialogues in each school over the 5 months of the program. And these parent dialogues were a great example of multi-sectoral team efforts, as it showed how the education sector, but also the child protection sector, gender sector, health sector, as well as the communities came together to address sexual violence. In the next slide, you can see photos of skits that were performed by pupils during these parent dialogues, also addressing sexual violence. And now the second component in the next slide involved pupil sensitization sessions. So these parasocial workers, along with the GBV specialists who were supervising their work on a daily basis, would held sessions during school assemblies to sensitize pupils to sexual violence, and also to let them know about this intervention that was about to start in their schools, and that aimed to help any child, or any pupil who had been through sexual violence and who needed help. The third component of the intervention is the training of parasocial workers. So as I said earlier, parasocial workers already work under the Ministry of Gender, which trains for 21 days all the parasocial workers. And we added for this intervention a 2 days training focusing on how to use the screening tool, how to provide first-line counseling, and how to make referrals. And these 2 days were also organized by the Ministry of Gender and in collaboration with a multi-sectoral team, again, including the education sector partners, the health sector partners, and the protection sector partners. Now, the fourth component is the screening itself. So parasocial workers used a child-friendly screening tool to ask children about their experiences of sexual violence, if any. And in the next slide, you can see the questions that were asked to children. First, we had a section on disability status because we really wanted to include also children who reported living with any disability. The second section is about the lifetime and current experience of sexual violence, where we also ask children about the type of sexual violence they've experienced, the timing, and the perpetrator. And the last section is about the help that the children who disclosed would want to receive, if they want to receive help, and also the interest also in having their parent or caregiver involved when getting help. Now, the service provision is the last step. So all children who disclosed received services in form of school-based counseling by parasocial workers, or for the more acute cases in form of referrals to medical services or child protection services. Now, before giving you just a brief overview of the findings, in the next slide, I just wanted to highlight the school enrollment and attendance statistics. And so from this slide, what we can take away is the gender gap, right? We see that boys are almost twice as double the girls in both schools. And this is because of the highest we go in the grades, the more dropout we have from girls in these specific areas. Now, what does this intervention showed us? It showed us that in just 5 months of screening, parasocial workers were able to identify more than 650 survivors and to link them to care. So all the survivors who were identified received school-based counseling, as I said, from parasocial workers, and 25% of them, or of the more acute cases, were further referred to services at health facilities. Now, an important also point is when we look at what happens in the absence of routine screening. So we compared the data that we had in just 5 months with the data that we had in 12 months, the 12-month period before this intervention began. And we saw that in all the 5 primary schools in Chirindongo refugee settlement, only 40 survivors were passively identified in this 12-month period. I'll finish by giving maybe 4 takeaways when it comes to the role of education and schools when it comes to prevention and response to sexual violence against children. Next slide, please. First of all, as we've seen with the findings, schools really operate as an effective yet underutilized platform to deliver sexual violence prevention, early identification, and response interventions for children. We also see that schools function as natural hubs for multi-sectoral engagement, so bringing together all different sectors, including the education, child protection, and health sector. And it really makes schools as ideal entry points for coordinated responses to sexual violence against children. The third key takeaway is that school-based screening reaches and supports boy survivors in ways that other approaches might not. And finally, these schools really serve as a bridge to parents and caregivers, so to also the wider community, as they really place high value on education and on creating opportunities to mobilize families and communities to be able to support their children, and especially child survivors, and also to address intergenerational trauma through this whole community approach. I'll stop here. Thank you so much. The report was published, so if you want more information, you can scan this QR code. And if you have any question, I'm happy to take them. Thank you.
Thank you so much, Abir, and congratulations on the incredible work that you do with the Baobab Research Consortium. Thank you so much. We learned that school-based screening, from this school-based screening intervention in humanitarian setting, that it can reach even survivors in ways that other approaches may not. And thanks for highlighting as well this whole school approach, which was, mentioned, highlighted by Patricia from the very beginning and also by Deepak. So congratulations. Thank you. We now move to our last speaker, Atta Muhammad from Right to Play. Atta, if you're ready, over to you. Thank you. Atta, you may start.
Thank you so much, Anula, and Thank you for the other speakers who have set the stage to build on it. So, as Deepak has shared, that the childhood sexual violence is not only the protection kind of issue which should be responded, but it is more systematic, and it is also an education issue because the school play a critical role in shaping children's attitude, behaviors, and understanding of the violence safety. So, in this presentation today, I will share you practical work that how right to play and education sector in Pakistan has been contributing to violence prevention through evidence-based approach. So, to begin this, briefly introduce right to play and our work in Pakistan. So, for your information, right to play is a uh, global not-for-profit organization that uses power of sport and play to protect, educate, and empower children and youth who are, facing adversity. We working in Pakistan since 2008, but throughout globally we are working since 25 years. So you can see the number we have reached half of a million children. But these numbers and thousands of teachers and schools and etc. and the different communities. But the more important is the impact we are creating. So go to the next slide. So in this regard, how we are, creating this impact is, important. So here in this slide, you can see that how we are working. So my two previous presenters has also speak about the whole school approach. So right to play adopt whole school approach. When we say the whole school approach, meaning we are not just working with the children, but we are working with the school leaders, teachers, parents, and other education stakeholders together to create the change. In our intervention, though we are working with the children of 5 to 16 years, but for violence prevention program, and especially the violence prevention program, our focus are the children of age 11 to 14. And why this age group? This is critical age group because in this age, shaping attitude around the gender, respect, and safety. So the key offering is that we deliver play-based life skill education that is strengthening their social, emotional, cognitive, physical, SR, and gender-related skills. So in this, the key are the teachers. So teachers play the critical role in it. So we do the capacity building of the teachers, and after that capacity building, they work as a what we say the protagonist or the change agent and in the schools. And after that, as we have mentioned, that the evidence is the key. Evidence is the key because uh, if you are imparting the program and you are not collecting the evidences, so we do the baseline, midline, operation researches, and impact studies. So some are driven by in-house, and some are scientific studies which are led by the external research agencies. So these findings actually contribute us to work with the ministry level, the government level for the policy, advocacy, and scaling of the program. Next slide, please. So this is one of the example. This is one of the example which the program we have implemented and in Pakistan. So you can see that here the research methodology has been mentioned. So we worked in a 40 schools. In 20 schools, we have given our intervention, which I have mentioned above. And in 20 schools, there wasn't any intervention. So it was a randomized control trial, which is considered to be the most reliable or, the prestigious study. And it was done by the external researcher to know the efficacy of the program, that how this program contribute in violence reduction. So after 2 years time, the intervention time was 2 years, and children completed 60 sessions, or 60 session of the play-based life skill education. Please go to the other slide. So these are the findings. So findings were interesting because, as we talk about the sexual violence, but the violence, if you see the pathways of the violence, they are interconnected. So in this intervention, focus was the peer violence, gender attitude, and the corporal punishment. Because if you are accepting the violence, which actually promote the sexual violence. So here you can see that after the 2 years intervention, there was a statistically significant reduction in boys and girls, and overall in all four, key results, you can see that there was greater impact on the girls, but there was significant impact on the boys as well. So you can see that the peer victimization dropped 33% in boys and 59% in girls. Likewise, peer perpetration was reduced in boys to 25% and 56% in the girls. The gender attitude was improved, 14% in boys and 18% in girls. Likewise, the corporal punishment in school reduced 45% and 56% among the girls. So these were the promising results. And basically, these results have given us the evidence that how our play-based life skill education model is effective and work with the core. Yeah, please go to the next slide. So
You
based
just
on
need to
this,
bring that. I'll move.
sorry, there is sound.
Yes,
So
go
so
ahead.
far I have shared. So that program was supported by FCDO, and that program called What Works. So it was What Works 1 in 2015, 2010. Now in What Works 2, which also supported by FCDO. So we, based on that evidence, we have a little bit adapted the program and added more sexuality education component into it. And now what we are doing is that, building on that success, we are aiming to integrate the gender transformative approach in the education system using same whole school methodology, so that you can consider the first program as a pilot, and this is the on the evidence we are trying to sustain it into the school system, so that it shouldn't be the short-term project, it should be the long-lasting impact. So here you can see the pillars. So the first pillar is the young people. So among young people, we are building their life skills, agency, and engaging both boys and partners. An educator equip teachers with the tool to transform gender attitude. And the school itself, when we talk about the school, the school leadership, the school management committees, they work together to foster safe, inclusive, and gender responsive environment. And also the community and the parents reinforce positive norms beyond the schools. So together, these pillars support mainstreaming and skill through education uh, in the education sector. Next slide, please. So here, this slide actually, shows that how education is structure supporting and BAWG prevention. So as I have talked about our program, the evidence, each and everything. So now in Pakistan, the education sector is supporting us that they are allowing teachers and they are sparing their time to deliver gender transformative life skill activities. And the other way is the, uh, schools work with right to play in the program to establish junior leader clubs, so that children should not be the only the beneficiary, but they also to be the agent of change and take charge uh, into it, and their wise agency and authority to be used. So school actually work with us and establish these children club, and they also these children also work as a the message carrier, and whatever they learn into the schools, they carry important messages to their home and community. So in the research I was sharing with you, the interesting one fact was remaining, which wasn't mentioned in the slide, that in the first Wattworks 1 program, we have noticed that there is a reduction in the corporal punishment at home. We weren't directly at that time, we weren't directly involved with the parents, but despite of there was a reduction in the corporal punishment at home. And one more indicator that there was less witnessing violence among the adult at home and in the street. So that belief build us that the children are working as a message carrier. And other aspect of the how school is contributing, that they uh, we work with school and they agree to form the school protection committees in their schools, and uh, in that committees, the teachers, parent, and students are the parts. And that committees monitor and respond, complaint, ensure child are safe in a school. And the one of the key important aspect is that they education sector actually validate the teachers' capacity building resources, as well as adapt for the inclusion. When I say the adapt for the inclusion, once we pilot it and then they include it in their system, so they are ready to include. The one example is that earlier, apart from the sexuality education, based on that evidence, they have included a social uh, emotional skills model in their physical education curriculum, and it is being implemented in the 40,000 schools in a subnational level. The other, aspect is that school work with right to play to organize awareness sessions of the parents and the, community at large. And finally, as I mentioned, that the overall the education sector at the ministry level, at the policy level, they engage to support scaling up the program by integrating play-based life skill education into the curriculum. So this is how education sector is contributing. Last one. So as we have mentioned the
Sorry,
program.
time. So if you can briefly take us through this last slide, that would be great because we are time. Thank you.
Yeah, just so we have talked about the the good things, but good things and the change comes with the challenges. So I think the cultural resistance, everyone knows about the cultural resistance because of the hard topics. Teachers, they are available, but there is workload, and we are looking forward. There should be the teachers, either the physical education teachers or other teachers who can carry the sexual reproductive health right and the social emotional agenda into the schools. And as I mentioned, the resource and infrastructure constraint is concerned. So there is a limited capacity, the limited number of teachers, very low infrastructure in school. So in that, and further, at the adoption level, at the integration level, or the mainstream level, the pace working with the government is slower. So you pilot it, and then there are their own tedious processes which take time to mainstream and scale the program into the system. So thank you so much.
Thank you so much to you, Atta, for this fascinating presentation on the right to play whole school approach in Pakistan, and for sharing the findings of the randomized control trial. Thank you so much. We are at time. I'm looking at the Q&A. I think we had 2 questions. One was already answered directly. There is one question on opportunities for young people, non-governmental organizations to formally collaborate with our institution, I guess, with the speakers and in addressing sexual violence. So I invite you to write to us. Our email address will be posted in the chat box. So you are very welcome to write to us so we can put you in touch with the relevant speaker. Are there any other questions? Okay, I can see all the thanks in the chat box. So thank you very much for joining us today. We would love to hear about your experience. If you could take a minute to respond to our Zoom poll that is appearing on your screen, that would be really helpful. We appreciate your time. This would be really helpful. And as we conclude, I would like to thank warmly our incredible round of speakers. I would like to thank Patricia for the opening remarks, Constanza for the evidence work, for Deepak, Abir, Atta for sharing this incredible insight and for highlighting your work, and also to thank the Safe Futures Hub team for their effort in organizing this webinar. A few takeaways as you take the poll. We heard that the high prevalence of childhood sexual violence occur in the system, and that there is strong evidence that schools are an effective but underutilized platform for preventing and responding to sexual violence against children, including in humanitarian settings. So schools really offer this consistent contact with children, parents, the community through a whole school approach and serve as natural hubs for multi-sectoral engagement. These insights are very helpful. They remind us that strengthening schools as hubs for protection and engagement can reach more children, support survivors, and engage families and community. And I do hope you found this discussion helpful for your work, for your practice, for your research, for your advocacy as well. Looking ahead, the next webinar in this series will focus on income and economic strengthening, and the role of income and economic strengthening in preventing and responding to sexual violence. We encourage you to follow us on our social medias, on LinkedIn, and to sign up to the Safe Futures Hub mailing list so you can stay informed and hopefully join our next webinar. Let me close with this final message. Safe, inclusive, and well-resourced education systems can reduce children's vulnerability, support disclosure, and strengthen prevention and response. I thank you all again on behalf of the Safe Futures Hub for joining us today and for your continued commitment to keeping children safe. Thank you very much.
Thank you, Manala. Thank you, everyone.
Thank you, everyone. It was really,
everyone.
it was really a pleasure to
Thank
meet
you.
you and seeing all your work. I would like to be in contact with some of you because you're working with schools, and for me that's so important. I have it's still recording. Okay, fine. I have I'm speaking at a school next week, so I would like to do it in the most sensitive and sensible way, so that my information comes across in a way that they are welcoming it and not seen as a threat to their school. You know, is that clear what I mean with that?
Yes. No, I really appreciate you taking so much care to talk about this issue, right? Because it's really important how we frame the issue.
So important. And I want to include as many people as possible in the conversation. And it's so difficult for so many people, for parents, for teachers, for schools, for survivors. It's just this feeling that I don't want to know anything about it, and many people feel threatened.
Sorry, Aronima, can we stop recording? Because I think it's still recording.
Yeah.
No, maybe we can cut that part.
Yeah, I'll cut that off. I'll cut that off. I'll cut off after the webinar.
We're by ourselves at this point.
Yeah.